Hi everybody, my name is Alexis Breed, and my response to this week's discussion prompt: if I were the CEO of a biotech company with a drug in a phase 2 trial that was maybe kind of starting to gain some traction, but phase 2 is still very early to make any type of assessments about the effectiveness or even safety of the drug. And if news outlets started talking about that, I would definitely say something, because I feel like no response is a response in its own, and if there is going to be any discussion out there about it, I would definitely want to get ahead of it and make sure that the right information is being reported, because I feel like if I chose to say nothing, then that leaves it open for misinformation. So I would definitely address it. I might come out and make a statement and say, yes, this is something that we're testing optimistically. So far we're getting results that we're happy with, but it's still too soon to tell. And I think I would probably make a big emphasis on the safety of it, that at the time in testing that we're at, we still don't know how safe it is. So yes, although it might be doing well and being effective at treating COVID, there's a big difference between that and is it safe for humans to consume? Because I think a lot of people, especially that don't come from a research background, maybe if some reports like that come out, they're very quick to jump on it and say, okay, well, it works, why aren't we using it? So I wouldn't want to give too much information, because like I said, I feel like especially people not from a research background, without the proper understanding, could definitely take that and turn it into something that it shouldn't be. So I would definitely address it by coming forward, like I said, making a statement saying we're optimistic about it. So far, we're seeing results that could lead to a positive outcome, but that it's too soon to really tell, and that we want to make sure that we're doing everything that we can on our end to test the safety of this drug, ensure the efficacy of it before we can take it into human trials and start delivering it to the greater goods. And like I said, I would stress the point of safety, because I feel like that's, at the end of the day, in clinical research, that's the main goal, is to safely deliver things, drugs to people that are gonna, at the end of the day, benefit their lives. So it would definitely not be a benefit to people taking something to market too quickly before we have all the results that we need, and before we can make the right type of inference. And if news outlets continued pressing after that, I would try to handle it as best as possible and say, basically refer to first statement, it's still too soon to tell. And we're not going to take anything to market before we're absolutely sure that it's going to, one, do what it's supposed to do, and two, keep people safe and actually be a benefit to people rather than a harm, because that's the main goal. So that might not be the answer that people want immediately, because like I already addressed, if someone hears that something's working, they're like, okay, well, let's get it going right now. So I would definitely try to just manage expectations, but also let people know that we're progressing, and we're optimistic to see where things go. And that's my take on it. Thanks.